Good morning, everyone. Welcome to Pedia Academy by Dr. Pankaj. Myself, Dr. Pankaj, and we are discussing this amazing series on NEET SS previous year's topics. So today we are discussing the important topic of the surgical anomaly of abnormality of jejunum and ileum, the intestine part, which is atresia are more common. So, without further delay, we'll start this topic of jejunal and ileal atresia and other associated anomaly in brief. So, jejunal or ileal atresia are congenital causes of small bowel obstruction. So, this is due to some intrauterine vascular incidents or accidents, and meconium ileus due to cystic fibrosis. Basically, this is due to congenital during developmentally some issue is there, so these conditions develop. So, what are the etiologies as per se? Any vascular event like if intestinal volvulus is there, intussusception is there, meconium ileus, and strangulated hernia, these conditions, these atresias can develop. And cigarette smoking and cocaine use in mother is also associated with these conditions because these things can lead to vasoconstriction, leads to vascular event in utero, and leads to this condition, these conditions. Multiparity, low birth weight, and prematurity are additional risk factors. So these are not familiar. Some autosomal recessive association is seen, and the type 4 actually. Type 4 is associated with TTC7A gene mutation, skid and recurrent sepsis. We will discuss this type 4, but as of now, just remember type 4 is associated with some genetic mutation, TTC7A gene, and associated with immunodeficiency. So, as we classify this jejunal ileal atresia, we'll just see this beautiful diagram. So, in this, just see type 1, only web is there, means two segments are connected but just web. So, this is type 1 mucosal web. Type 2, two segments are separated and these are connected by solid fibrous cord-like structure with mesentery intact. As you can see in both type 1 and type 2, no mesenteric defect is seen. We are coming to type 3. Type 3 has two variants, type 3A and type 3B. Type 3A, these two segments are separated and V-shaped mesenteric defect is there. But in type 3A, the blood supply of mesentery and segments are intact. Type 3B is similar to type 3A, but mesenteric defect is more and blood supply is low. So this is apple peel appearance is also seen. This is actually most common. This third is most common. Third B is slightly more common than third A. In type 4 of this atresia, multiple atresia are seen as we discussed earlier also. This is associated with TTC7A gene, SCID immunodeficiency. So this is the important classification. So in this continuing discussion, apart from jejunal and ileal atresia, one of the other common condition is meconium ileus. So this condition is associated with cystic fibrosis. 80 to 90% of meconium ileus conditions are associated with cystic fibrosis. This is important. This can be simple or complicated. So, what are the differential diagnosis? As we know, Hirschsprung disease, GRD, adrenogenital syndrome, and inborn error of metabolism. So, this is actually any surgical condition which can get problems, obstruction. So, this is that. So, how you will clinical manifestation and diagnosis of this condition? Polyhydramnios, abdominal distension, vomiting, failure to pass meconium, and jaundice. Failure to pass meconium in 80% infant, and polyhydramnios seen in 20 to 35% of cases. Imaging finding like in X-ray, air fluid level seen in obstruction, absent meconium ileus due to viscous material. So as we can see in this condition, the air fluid levels are seen, And laparotomy, two segments are adriatic and these are connected with web-like structure. So this is classical type 1 of intestinal atresia. Okay, so we are continuing our discussion of meconium ileus. So when you do X-ray, this is a hazy appearance. Pneumoperitoneum may be seen, and contrast studies like water-soluble enema. These are actually therapeutic and uh, important also. Okay, so treatment. You have to do like jejunal and ileal atresia. For that, resection of aortic segment with end-to-end anastomosis you have to do, and you have to do ostomy, creation, bowel tapering, and for mucosal diaphragm, jejunoplasty and ileoplasty has to be done. For meconium ileus, gastrographic enemas, laparotomy, surgical resection, and acetylcysteine irrigation can be done. Okay, outcome is outcome is actually depend on surgery and the condition. So generally this condition is devastating condition for parents and the newborn. So many complications are there. So this was it for jejunal and ileal atresia along with meconium ileus. We'll discuss some another topic of this amazing series. Till then, do share, like, and